record us so that we have this for everybody else. So welcome everybody. I can't imagine a more timely topic of discussion today about COVID vaccines, what's next. We're very fortunate to have with us today Margaret Shapiro. Margarita is definitely no stranger to all of us, as she is currently the Community Health Coordinator for Visiting Nurse and Hospice of Fairfield County, and brings with her, and she corrected me on this, over 40 years of experience in nursing since receiving her RN BSN from Temple University. She's worked in pediatric, psych, to coordinating immunization clinics here in Wilton for RVNA and now for visiting nurses and hospice. Along the way, she also worked for Congressman Jim Hines for a time and was able to share with him her expertise on healthcare issues, so she fully understands the relationship between politics and health. Now Marguerite is back where she belongs, working with seniors. Please welcome Margaret Shapiro.
Thank you. Thank you.
Hey, Margarita.
Hi. So nice to be with you all. Lisa, thank you so much for having me. Boy, this is a hot topic. And before I get into the nuts and bolts, I just wanted to explain to you why you have a nurse talking to you about this and not a physician. And I think that there's a really good reason for that. First of all, I'm absolutely a people person. And in all of my nursing, I always thought that what was the most important piece of nursing was the individual story. What does an individual bring to their health and their illness? And so when I listen to people's individual stories, I always find that that really has an impact on their outcome and how they make decisions. And it's so important to understand people, because the decisions we make are not made in a vacuum, and they're not made in isolation, except for maybe with COVID recently. But I find that nurses, and myself in particular, that I just tend to look at healthcare problems a little differently than maybe a physician would, because physicians look at numbers, data, how to, cure something, how to fix something. And I really am more about, if we can't fix it, how can we make it better for you? How can we make it work for you? And I think that is the jumping off point for where we are today. And you know what, I'm going to go back for 1 second. I always look at risks with healthcare. So whether it's somebody learning to walk after an accident using a walker, somebody who's diabetic, who has a change in their medication, and they have to change their lifestyle. We always look at, and we all do it. I think sometimes some of us don't do it consciously, but we all look at risks. What is that going to mean for me? How is that decision going to impact tomorrow or next week? And so risk is a really big part of this talk. And risk always comes into play in whatever we do. If you're learning to teach a child how to swim, you've got to decide, is this the right pool? Are the right people around? Can I trust these people to watch my, child or grandchild? Can I let my son go to play at that house? My son went to a play date, and I found out the day he was going that there were guns in the house, and that the kids, this is in 7th grade, that the 2 boys were sons of a policeman, that they would take the guns down and show each other. So, you have to sort of do this like a risk assessment. You know what? I don't think that's a good place for my son to go play. And some people would have handled it differently. I chose to talk to the mother, ask her to show me the guns, and talk to the police officer, who was shocked to find out he had no idea when he wasn't home that his boys were taking these guns down. So that's a pretty black and white, clear decision, but we always are looking at risks and our choices in it. So where I'm going to start with COVID, and if you all have questions about the vaccines, I'm assuming you're all vaccinated. Is there anybody here who's not fully vaccinated? Oh, Lisa, you're not. So if you've had one. So you'll take part of what I'm saying. It'll incorporate a partially vaccinated person and a completely vaccinated person. But I just wanted to start, and please interrupt me if you want to ask a question. And Lisa, please don't be shy if I get off topic. Just pull me back, okay? Because I got a lot of notes. I was really trying to get myself focused yesterday. So I wanted to look at three prime areas, where we've come in the last 13 months, and what did we do as individuals to keep ourselves safe, and what's now, what's current. So we all have lived through a horrific 13 months. I'm going to guess that anxiety, loneliness, fear are probably the top three issues that people have faced. I mean, you can't get away from the news. I found halfway through this, by around August, September, I had to turn the news off. If you have any sort of depression or any sort of, just being isolated makes you depressed. I could not cope with listening to the news. So, a year ago, we had 29.4 million cases confirmed, almost weekly, and 535,500 deaths is the number as of Johns Hopkins yesterday. And in this, and those numbers, I see it on TV all the time. I see the memorials to people we've lost. Those numbers are really heartbreaking and terrifying. And yet at this point in time, I don't want those numbers to, impact you so much that you're not going to be able to loosen the guidelines and get back into a little bit more of a relaxing, fulfilling life. So what I find interesting, I think, is that we had fear for the past year. We were isolated, and I'm sure many of us dealt with loss. So as we move in to what did we do as individuals to try to stay safe, some of you might have decided just to isolate and not to go out at all, and to rely on family, friends to bring you food, your mail. And I have a friend who did that, and she's 93, totally amazing, and it was driving her crazy. She couldn't go to the post office. And her family, her friends, me, I was at her door and I said, I know you don't want anybody living with you, but if you leave to go to the post office, I'm moving in. And for a year, she walked to her mailbox and back, and people dropped off food. She would see them outdoors, if it was a nice day, masked, but never for more than like 5 or 6 minutes. So some people did isolation. Some people did go out, did go grocery shopping, and I don't know what if this applies to any of you, but you might see yourself in this. And they became compulsive cleaners. I did that for about 4 days, where everything that came back from the grocery store, I was wiping it all down. I was airing out the bags in the sun. I was going in and wiping my steering wheel down. And I do know a lot about vaccines. I've been doing this for a long time. I've been doing immunizations for about 25 years. And I've read a lot about viruses. And I will say to you that from the very beginning, in March, at the end of February, when the CDC came out and said we don't need masks, I went ballistic. And I was working at another agency, and I just was stomping my feet. This is not right. They're not right. They're not being truthful to us. And there were a lot of reasons, I think, for that, which I'm not going to get into, some political, some having to do with scant resources. I thought they did the public and first responders a real disservice in not being really transparent and upfront with us. So I knew from the beginning that this was going to be transmitted by particles, respiratory particles. So I was only cleaning stuff off for about 4 days. And then I kind of went, wait a second, I'm really getting sucked into this hysteria. This is not what's going to hurt us. What's going to hurt us is talking to people, laughing, sneezing, not having a mask, not keeping our distance. But I know many people have continued to, double glove when they go into the grocery store, double mask, which I'm totally in support of double masking if it makes you feel good. And then when they get home, wiping all the packages down moving them into their garage, going back out. I have a girlfriend, it takes her 45 minutes to disinfect her car. And then she takes her gloves off. And I said to her, well, that's so interesting because, excuse me, your gloves have been with you all over the grocery store and unloading packages, and then you clean the car, you're taking your gloves off, but do you wash your hands after you take your gloves off? And she sort of looked at me and she said, well, sometimes. And I said, well, the problem with gloves is if you don't understand the behavior that is associated with gloves, it's a moot point. Gloves cannot protect you. Okay, gloves, the second you do this, Sally, I just saw you do that, made me think of it. The second you do this, the second you sort of scratch your nose and you have gloves on, you've broken whatever attempt to keep yourself clean. So, and the masking, I said. So here we are today, vaccinated. I think still afraid because we don't really know what's going to happen in the next couple of months. We have the incidence of variants that have now come out of the UK, Brazil, and South Africa, which are in this country. And we need to look at new behaviors. So I would urge you, I'm starting really simple. I would really urge you to reduce glove use. If you can let go of gloves, I would tell you, let go of gloves. First of all, believe it or not, in my business, gloves are hard to come by for nurses. They're in short supply. So as long as the whole community is using up gloves that nurses could use doing wound care in a hospital, you're doing everybody else a favor. You don't need the gloves. You do need alcohol gel cleanser. I carry one in my purse, a small one, about this big. And when I go into the grocery store, I do wipe down the railing of a cart. They have wipes there, I use them. And I clean my hands and I clean my hands going into the store, really not for me, but for anybody else that might come behind me. And then I do my grocery shopping. I put my bags in the car. I get into the car, and yes, I clean my hands again with alcohol gel. Sometimes I wipe the steering wheel. You know, when I do it, I always think, Margarita, it's really foolish, but that behavior is a little bit of a routine that makes me feel safe. So this goes back to what behaviors make you feel safe. And I wash my hands at home after I've gone grocery shopping. Doesn't matter, I've used alcohol gel cleanser. I wash my hands. I wash my hands at work, frequently. So I would really urge you to look at those behaviors. And if you're with a group of people, and I'm going to get to the big question, which I know is, can I go out and see my grandchildren and family? I'm getting there. But if you're in a group of people and you're not shaking, I still wouldn't advise you to be shaking hands, but you might be sharing platters of food. You might inadvertently be, and again, this comes down to whether you're all vaccinated or not. I still recommend that people, just like you do with flu season, this is the same advice I give people in flu season. If you're in a crowded room and people are coughing, and if everybody's vaccinated and they're not masked, which is allowed now, what are they going to do when they cough? I'll bet 75% of people are going to cough into their hand. Maybe they'll cough into their shoulder. But I tell people at flu season, and I tell people now, if you're with a group of people who are unmasked and you have a chance to go to the bathroom, maybe every hour and wash your hands, or just pay attention to behaviors around you, good hand washing is super, super important. So the fourth area is let's move forward. And really, my goal, I was talking to my daughter this morning. She's in Texas, where they've just dropped all mask mandates. And I know Lisa's got a daughter there too, so she's nodding like we've been talking about what a crazy state. And I was talking to my daughter this morning and telling her I was going to do this. And she said, okay, just give me a little roundup, but what are you going to say? So I started telling her, and she said, no, you can't do that. And I promised her that my goal was to help you reduce your fear and anxiety, okay? You can turn on the TV and hear a lot of stuff to make you anxious. My goal is to present the information and answer your questions in a way that will reduce your fear and anxiety, that will help you say, oh my gosh, I'm so glad I got vaccinated. I can go out and go grocery shopping now. I can go out and get my hair done. I can go see my grandchildren. And it's time, really, it's really time for us to reconnect. And so as we're going to talk about these questions, and we go back to risk assessment for a year, the risk was that we were going to get sick, and we were afraid of that. So now I think, and honestly, they've seen this, the data has shown that in the ICUs, where they were really not allowing family to visit people in ICUs, in nursing homes, that they found that once they understood the virus and they understood what was going on, and they've allowed family members to come in and be close to one another, guess what? Not as many people are dying, because we need each other. We need to be in the presence of family and people who love us, who want us to be there. And so it's been mind-boggling to me hearing from friends who have had family members in the hospital and ICU that, the tide has changed, and they are allowing family in to talk to people, to hold their hands. I will say in this area, I've heard that some nursing homes are being a little bit more flexible, some are not. But what is essential is that it's time for us to reconnect with our families and our friends. So I want to try to help you make that happen. I'll give you a couple of resources from a couple magazines that very clearly went over some of the guidelines. But let me just tell you briefly right now, what has the CDC put out? See if I can make it a little clearer. So we all know what we've done in the past: social distancing, covering your mouth and nose if you're going to sneeze or cough, 6 foot the 6 foot social distancing. If you feel unwell, you were told to stay home. If you feel unwell now, I still urge you to stay home. And refrain from smoking or any action that weakens your lungs. This is a respiratory disease. And to avoid travel. The CDC really wants to avoid air travel. And having said that, it's really interesting that I heard somebody from the COVID task force. It wasn't Fauci, but it was somebody, I think, who works with him, who said that he and his wife are now both vaccinated, and they're going to get on a plane and they're flying to go see their daughter, who they haven't seen in 13 months. And I thought, well, that's sort of a double message. Don't travel, don't get on airplanes, but this guy is going with his wife. So I will, if you have a question about airplanes, I will talk about traveling on airplanes. So we have 2 vaccines. We're all vaccinated. Lisa's almost all vaccinated. What are we still supposed to do? We're still supposed to wash our hands. We're still supposed to wear a mask when we're in public. So if you're outside on a trail walking, or you're, I was outside of the Danbury Mall the other day, and I was all by myself, and there was nobody around me. Well, I didn't have my mask on. But if I was to walk towards the steps where there were a bunch of people congregated, I would have put my mask back on. So if you're in public and you're near people, you should put your mask back on. Maintain that physical 6 foot distancing unless you're all vaccinated and you're in a home with family. We'll talk about the distancing. And the vaccine, I want to remind you, protects you. And it protects you. If you've gotten the Pfizer or the Moderna, and these are probably numbers you've all heard, we're looking at like 94, 96% protective mechanism, meaning what that really means is that you have a 96% chance of not getting sick and not dying. And that also is dependent on who you are, your risk factors, and your behavior. So the older we are, the weaker our immune system is. And I got both vaccines. I had no reaction. And my sister who's about 6 years younger than me, loves telling me that she got the vaccine and she had a terrible reaction, which is a good sign. It means your immune system is working. And we know that younger people have had much harder responses, much worse physical responses because they have a more active immune system. Does that mean you're not getting protected? No. And the data has shown, and I know this to be true for the Moderna, because that's the vaccine I'm working with and I've been reading a lot, that on their trials, the 88% efficacy in the trials was across all age groups, ethnicities, all demographics. So we're looking at a very effective vaccine. Johnson & Johnson has a little bit lower number, but I think in terms of what it's going to give us in the community, I think it's really, they shouldn't really be discussing and arguing about that too much. So the vaccine is going to protect you, but it's not going to protect you really a full 96% if we don't achieve herd immunity. You've heard people talk about herd immunity. Herd immunity cannot occur within one little town or village. You cannot get herd immunity in Wilton and then go to Westport where there's no herd immunity and you could pick something up there and bring it back. Herd immunity has to be national, and we need 80% of the population vaccinated. As of yesterday, we had 9% of the population vaccinated, according to Johns Hopkins. And that's a big difference. So this is why they're talking about keeping your gatherings to small groups, to people you know, people in the same family, and to avoid traveling long distances. Because every time you put yourself into one of those situations, you're going to go to, suddenly the town is, or your group might decide to have a little gathering, outside. Well, if 40 of you show up and you're all vaccinated, have fun. It's not a problem. But I still would not be on top of each other. I would still be keeping a little bit of a distance, but I feel pretty safe being with 40 people who are vaccinated, all vaccinated, outdoors. If a friend of mine was having a cocktail party and she was inviting me over to be indoors because it's too cold to be outdoors, and there were going to be 40 people and half of them were vaccinated, I personally would not go. Or I would go and I would wear a mask and I would ask her to please talk to the other people who are not vaccinated. They should really be wearing masks. So remember, the mask is not protecting them. You wearing a mask is protecting someone else. So you go to that cocktail party where half of the people are not vaccinated. Those are the people that need to wear a mask so they don't transmit anything to each other. And there is still a chance, I just confirmed this, they think it's slight that you would be able to transmit the virus with having been vaccinated. But again, if you put yourself into a situation where you are, let's say, one of 4 people among 20 that are not vaccinated. So you and your friends are vaccinated and you're going to a party, but most of everybody else isn't, you raise that risk. And the chances are when you travel in an airport, even though everybody's masked, you get crowded into a waiting line. You're waiting to board. I mean, I haven't traveled in a year, so I don't know what it's like. It used to be a nightmare. I don't do well with crowds anyway. So you're waiting to board. The person in front of you is coughing. They're wearing a mask. You're wearing a mask, but you're still upping your risk of being exposed to people that could be giving off virus. And you won't get that sick, probably, and you probably with the vaccine, they're really pretty confident. The deaths have really, really decreased. And the deaths that we saw in hospitals, as you all may know, are really more among the people 75 and older with risk factors. And that's gone down since we have started vaccinating. So people who are getting sick, who are vaccinated, are not dying and they're not getting as sick. So the CDC says that if you gather indoors with fully vaccinated people, everybody's vaccinated and you're indoors, you don't have to wear a mask. I would still, as I said, be careful about people's behavior. Someone could be coming down with a cold and really coughing. I don't want to get a cold, okay? And just like I said, I say this at flu season, if I'm in a room with somebody really coughing, I may just kind of decide not to get that close to them, or I'll go wash my hands, frequently. If you're at a party, if you're indoors and with unvaccinated people, so this is the important part, from one other household. So Lisa decides to go visit her daughter, not in Texas. Let's say your daughter lives nearby, and you go to see your daughter, and she and her boyfriend are unvaccinated, but you, your husband, and maybe another sibling or an aunt are vaccinated. You're merging with one other household. And why are they limiting it to one other household? Because what you need to do is look at the character and the risk. What is that other household doing? If your daughter and boyfriend, and I'm sorry, I'm just picking on you, Lisa, because I can see you big screen. If your daughter and boyfriend are remote working at home, only going for grocery shopping, they're doing it fast, they're washing their hands, they're masking, they're not going to bars, they're not going to work out in the gym, then I would say, you know what? Their behavior is very risk averse. They're being very careful. I feel pretty good being with them. And the CDC says that you could be with them without masks, unless anyone they live with is at increased risk for severe disease from COVID. So that goes to the fact that we don't know if we can transmit the SARS virus having been vaccinated. So Lisa's daughter and her boyfriend come to visit, and the boyfriend's grandmother lives in town, or mother lives in town, and she's got really bad emphysema, and she's been on a lot of treatments for that, and she's coming with them. Okay, you have one individual who joins this group who is at risk for severe disease. You all mask to protect her. Or you move the event outside. The CDC is really clear. If you can't be, they prefer you to be outside. If you can't be outside and you come in and there's one person who's at risk, then you mask. So there are a lot of disinfectant products out. I don't know if you want me to get into that. There's some new ones out where if you spray the area, like in bathrooms, it leaves a residual presence, and it's called, it's under the FDA N grouping. It's an N list. So if you went to the FDA and looked for N list products, N is in Nancy, it'll give you a list, and I'll tell you that Lysol is on that list. There's some other generic names that I don't remember that also have similar things in it. And I am not super paranoid about bathrooms. I mean, I clean the bathroom. Certain people that are coming over who are paranoid, I get out the Clorox wipes, I leave it on the edge of the sink, and I say, hey, go knock yourself out. I clean the bathroom, but if you want to do an extra thing, you can do what you want. So they say if you've been vaccinated to wait 2 weeks after your second vaccine to travel, and that you still should be getting a viral test before travel and after travel. So if anybody's planning to get on an airplane, one, I would ask you to really look at what state are you going to. And again, we look at the the number of viruses and the variants. So you can look at a map on the CDC, and you can see that California has a lot of this UK variant. Texas has the UK variant, and I think they have another. I'd have to look at the map again. I made a note here that Texas is a state that also has some variants. The variants are all over the country. Some areas, maybe only 1 or 2 cases, But I still think that if I was going to travel by plane, Florida, I've been told, a friend of mine just came back from Florida. They didn't even know what masks were. Nobody was wearing masks anywhere. So that brings me back to, okay, why am I going to go to Florida? Can I avoid it? Can I wait a few more months? Because what I'm going to end, I think, on this note. The variants are a new item that we have to contend with. And mutations with viruses happen all the time. They're not unusual. The J&J, the Johnson, called the Janssen by J&J vaccine, actually was out and they did trials with the variants in circulation. And they actually found out that the Johnson vaccine did very well against variants. They think the COVID and the Moderna and Pfizer vaccine will also do well, but they did not have the variants in circulation when they did their study groups. So those 30,000 people that they studied, were not exposed to any variants. So their educated guess is that they think that it'll probably do well, and they're collecting data every day. They're assessing this. So I would just look carefully. Where am I going to travel to? How am I going to fly? What precautions am I going to take? Am I going to double mask? You have to mask. I would double mask, especially if I had any risk factors. I have a cousin that goes to Tampa because her daughter's down there and the daughter's been sick. And my cousin is not vaccinated. I could not convince her not to go, but she did go double masked with a shield. They say the window seat is the safest seat on the airplane. She got a window seat. She doesn't get up to go to the bathroom. She doesn't accept any drinks or food from I don't think they're serving food and drinks. She brings her own bottle and she brings her own wipes to keep her area clean. And she always waits to be the last person off the plane. So she's not standing, which I always do anyway. So she's not standing in a crowded, narrow space. So I think that I'm going to say that if you want to go out and visit family and you want to see your grandchildren and you want to put your grandchildren on your lap and you want to hug them, and your children, the parents of this grandchild, maybe only half of them are vaccinated or they're not vaccinated, I would say you have to ask them, what are they doing? What are they doing when they're not at home with their kids? Are they going to the gym and working out without masks? Do they stop at the bar on the way home and have a drink? And people don't wear masks at bars. And that has to sort of educate you to, okay, I'm going to go into the house. I'm going to hug my grandchild. My grandchild's going to sit on my lap. But maybe I'll decide to keep distance from my children. They say that the contact shouldn't be more close contact. If you're worried about transmitting something, I think that I would not have my grandchild sit on my lap for 15 minutes, like maybe a few minutes, and then, do another activity, move around, and then maybe have them come back, hug them for a few more minutes. I think that having a small child sit on your lap for extended periods of time, I don't know that, and I'm splitting hairs, which I tend to do. I just don't think that we're quite there. If we could last another 2 months and see what happens with the variants and see where we get with the number of people in the community immunized, we've come this far. I think going to see family members, having a dinner with them, reactivate your book club. And if you're all vaccinated, go to Sally's house and have your book meeting and relax and enjoy it. But let's not invite the new person to the book club who isn't vaccinated. Let's ask them to wait. I'll tell you that I heard, if you haven't listened to, there was a great story on The Daily about Israel. Israel has had, of course, it's a small country. I would love Connecticut to be able to do this. They've had an incredible amount of vaccinations. I mean, I think they're way over 80%, 85%. And everybody gets a green card, a green passport card book. And so the speaker said she went to a concert with 500 people in Tel Aviv, but they all had the green book, which means everybody in the concert was vaccinated. That's fantastic. You know, if we got to that point, we could go to restaurants that say, if you're vaccinated, you're welcome to come in here and eat, and you could go in and eat unmasked. And the servers would have to mask if they weren't vaccinated, but I would think they should all be vaccinated. So, any
I'm going to unmute.
any questions?
Hold on. I have to unmute people.
Okay.
Thanks, that was great. I have a question. Totally, I'm throwing it out there because I know there's not an answer right now. All of us have been, most of us have been vaccinated now with our second shots. I've heard from the CDC, we don't know how long the protection lasts. It could be as little as 4 months. So what do you tell us now? March, April, May, June. Okay, those of us in this group and others who've been vaccinated, what about July, August, September? Will there be a booster? How do we plan anything, not even knowing how long our protection lasts?
So, you know, I guess I have maybe an unusual trust in the government and CDC. I don't really trust the government, but CDC I do. And I know that, so let me just start this way. I know that when they came out, so we don't know. I know you're not Jim. I know you're not Jim, right?
No, he's right here. I'm Ellen Kapuska.
Oh, hi, Ellen. So
I'm here, tuned
hey,
in.
Jim. Hi. So yeah, so the uncomfortable answer for you, which you don't want to hear, is that it's true, they don't really know. But, you know, they've been examining these 30,000 people since, I'm going to say, I think that they were looking at them back in August. They started working on this, August, September. So they have a very big group that they're going to be able to follow for a year. And believe me, they're taking blood samples, they're checking antibody results. And so I really have a hard time believing that to be true, that there's not going to be longer lasting immunity. When the hepatitis B shot came out decades ago, we were told, oh, you get one shot, you're going to have short immunity, and then you're going to have to go get a booster. Then they realized, well, yeah, you're going to have to get a second booster, but in about 5 or 6 years, you're going to have to get another booster. And then now you don't need a booster. And now we know that it's a once in a lifetime shot. Yellow fever, which is a live vaccine, used to be every 10 years. And then the more they looked at transmission, now they know it's just once in a lifetime. I mean, and yellow fever vaccine's been around a long time. Are they going to come out and say, we don't know, we think we're going to need to give you a booster every year? They might. And the only harm in that I can see is that I hate needles. You know, I don't want to have to take another needle. I'm happy to give you the shot, but I don't want to take another needle. But am I afraid that, you know, it might not do the trick? No. And to your point, Ellen, and I did not hear that. I've heard 42 days about the longest time that they want someone to wait to get a second shot is 42 days. And this 42 days has come up and is floated around, and I hear it coming from different areas. I have not heard this, that it might only have a 4-month immunity.
Oh, you just Google how long does protection from coronavirus vaccination last? Just Google it and you get, there's CDC.
Does the CDC
I believe so. I believe that the average of what I saw was 4 months.
So we know that 2 weeks after the second vaccine, you have really good antibodies and good immunity. And so I think that because of where we've come from and because of the stresses we've been under, that we can't plan that far ahead. And we haven't been able to plan, I haven't been able to plan more than a day ahead for a year, right? And I think we can't plan 4 months ahead. My feeling about how I live my life, believe it or not, has really changed this year. I have realized, I mean, I've talked about this with cousins and friends. I've never really thought about my own mortality. And I don't have grandchildren. And I've never really thought about, I'm not a frightened person in terms of, getting ill or catching something. And I found this year made me stop and realize that I could get hit by a bus. I don't know what's going to happen. And I don't mean to sound trite. I'm not at all putting down your question that how do we plan? The reality is I don't think we can plan more than a week out. And really, and if you have family you want to see and grandchildren you want to see, we should do it now. We should do it now before the variants really take hold. And while we know what we know, because my feeling is that in 2-3 months, they may say, oh, we have another variant out there and we don't know what's going to happen with that. It's not a good answer to your question. I'm sorry.
There isn't a great answer right now. We are kind of the first tranche of the,
exactly.
The big sort of, they're going to formulate the data from us.
Right.
So I know that was not a fair question in that sense, but back to your kids sitting on your lap, grandkids. We have 2 older, 11 and 13, and they are just in Fairfield now going back to school full time. And we've seen them all the time outdoors.
Mm-hmm.
Can you speak about with an older grandkids who are in school, they're not stopping at bars, they're not going to the gym,
right.
They're in school. What should be and my kids are not vaccinated yet, but they're coming up hopefully in the next month or 2. So how should we behave towards them? Just stay outside? Can I hug them?
Yeah, I think you absolutely can hug them. I think you absolutely can hug them.
Thank you.
Excuse me. I would probably not kiss them on their face, kiss them on their head.
They wouldn't let us anyway.
They wouldn't. Jim says they wouldn't let us anyway.
So there you go. Yeah, I think you can hug them, and I think you can have a meal with them.
Indoors.
Well, so they're a member of one other household. Right. And so you're in touch with their parents, who they've been around. I mean, if you tell me that your 13-year-old has been going and spending weekends at, a friend's house and hanging out with 8 or 10 other kids, then I think you might not want to hug them.
Yeah.
But you could still be in the room with him.
Right.
And you keep your 6-foot distancing and your mask is off. And the other trick to being indoors is the air ventilation. And that's one of the things when they talk about air flight that is an advantage, is that there is really good air circulation on a plane and in the restrooms. And at home, when I've had people over, and I did this over the winter, I had a couple over who I was dying to see. Their kids are also in Austin, and the whole freezing thing had happened, and we were all like going nuts. They came over. It was a very cold night. I opened the porch door into the dining room. I opened 2 windows. And we all sat there inside to eat, but we all had our down coats on. So you can do it. So, but air ventilation is really important, that you have air blowing, not from them to you, but Jim, you're right, but from them out.
Yeah.
So if you're in a position with a fan behind you and they're in front of you, you're pushing the air across them out.
I think, Mary, did you have a question?
Yeah, actually, she's here, but this is Debbie, her daughter, so I'm her caregiver. I just want to be honest. I think that we have to be really careful about, it seems like there's a lot of opinion, and I think we also have a lot of opinions from experts. They have said they're not sure about a booster, so that's still out there. I think there's still too many uncertainties to say we could go to a cocktail party with 40 people that have all been vaccinated. Unless I misunderstood that.
No, that's what I said.
Here's what, as far as being safe, insofar as being safe, I would never do that. Even though I'm vaccinated, I would never suggest that my mom go to something that with even some of the gatherings that people are suggesting that they may be doing now in the next couple of months. I still double mask. I will
Mhm.
continue to double
Me too.
mask
Me too.
until, okay, but I think some of the things you've indicated, like have the kids sit on the lap for, a few minutes is okay, but 15 minutes isn't. To me, a few minutes is going to expose whatever they might be carrying to someone who you don't want exposed. What's the difference? I mean, 3
Well,
minutes to 15 minutes.
the CDC guideline and the contact tracing, all of that is based on the transmission of the virus. Usually you have to be within very close contact with somebody for a sustained 15-minute period.
Right.
And so if the contact is short and then you're distancing, you're just reducing your risk. I absolutely agree with what you're saying. Some people would never go to a cocktail party with 40 people vaccinated, right? And what I would say to the hostess having that, and to a friend who called me and said, what do I do? You have to do what you're comfortable with. And the same as me, I'm not getting on an airplane, but there are plenty of people who are
That are
willing to
doing
take
it.
that
I
risk
know. Yeah.
to go on the airplane. And they keep coming back and calling me and telling me, I don't know what you're talking about. I'm fine. I've done 10 airplane trips. I'm fine.
There's so much misinformation and so much that it became political. It's never going to not be political now, and it's unfortunate. And so you have a lot of people out there that are saying, oh, I'm not scared of it, I don't care if I get it, and kind of the thing. And so you have people that are defiant. You have the most populous state in the union now that are dropping everything. They're 47th in the country as far as vaccinations. I think we don't even know yet what surge may be coming. So,
and I actually did not address that. The reason that the CDC and Fauci are really against travel, long distance travel, is because what we've seen over this year is every time there's a rush for long distance travel, and now we have spring break and Florida's going crazy. The governor yesterday was just pleading with people.
Well, that's his fault. I'm sorry. He's completely.
Yeah. But they know that when that happens, we're going to have a surge of more hospitalizations. And until we really get enough people vaccinated, the people who are at risk are the unvaccinated ones.
Well, again, to be the Debbie Downer, or the, being erring on the side of extreme caution. Yep. I think there's so many unknowns that I know I definitely feel more protected. I feel a little safer, but I think with these variants, and it's still a lot of unknowns, and that everything, we didn't know that these variants, we weren't even sure. And now all of a sudden we're dealing with variants that we weren't even sure about. They're more contagious. They're 50% more contagious. They weren't sure if they were going to be more deadly. Apparently they are even, more.
One of them is,
the UK one, I think. So, who's to say after this next surge? And I believe we're going to have another surge because of what's happening now. So I think I still would, well, that's just me. I would probably still do, I think I would probably limit, as I think Mom and I were talking, to family gatherings. I know everybody would love to be able to have lunches and get together again. Outside might be good. And, because stay at home and Encore are hoping to have, some lunches and gatherings again. I'm not even sure that this summer would be a good time to start doing that, unless we're maybe, can stay outside and further apart. So I just think we're still gambling a lot.
Well, we're absolutely still gambling, but I think I really look at it from, what does the person who, these are individual choices. And what does the person who has been isolated and is really feeling, terribly alone, and what is it going to take to change that and to sort of make that person feel, and not only feel better, and of course the risk of getting sick, we don't want someone to get sick, but when you look at some of the, and I'm not just talking elderly people, I'm looking at college kids, suicide rate is up.
I know.
It's terrifying. And once these kids can get vaccinated and we can sort of take this layer of fear away, is it 100% away? No. But I think the fact that you said, you feel a little safer. I feel a little safer. I was not the one going to do grocery shopping because I'm a very slow grocery shopper. And now I am. And, I don't talk to people in the grocery store like I might have. But so you just have to kind of weigh, what is it that, that you feel you need to do. And when I was talking about a cocktail party with 40 people, I think if you're, I still think that if the people who decide to attend are pretty healthy and don't have a lot of comorbidities, and you have ventilation and you can distance yourself. We're trying to do a 50th reunion for my high school, and it always lands in October. And I was telling them, October is not a great time to do this. We need to do it. Of course, we missed it last year. We had to cancel because of COVID. We need to do it in the summer when we can be outdoors and we can space. So,
She made all of her points.
it really, I think it really is very individual and very based. Your mother is lucky to have you. You see her every day. You guys are together. You get to talk to her. For people who don't have that ability, I would say, you know what? Maybe a little bit of a risk is worth it.
We did see we saw family members before we had our second vaccine. We both had our first, but we all remained at least 8 feet apart and everybody had their masks on. And she hasn't held her great granddaughter since she was born, which has been over a year. So, anyway, we've had a lot of discussion about going forward because we're vaccinated, but the kids won't be yet. And so I don't know, it's just, it's really been, the psychological impacts have been just.
So would you feel safe with a double mask and then holding the great granddaughter?
I would, and so would Mom. Sure, we would. Yeah, I mean, we would still keep masks at that point, but only because at this point, our my niece, her granddaughter, the baby's mother, and her husband haven't been vaccinated yet. So so there's going to be a mix there, even though it's like. Yeah, I just feel after this past year that there's still uncharted waters.
Oh, yeah.
Sometimes I worry about the worst could be yet to come. I mean, we just haven't. I mean, like I said, I hate to sound so doomsday, very negative, but we've had, you're right. We've come out of a terrible year of 2020. I think that it was handled terribly by our government. I'm glad we're in better hands. So I do trust there more, but we're just really behind in terms of the kinds of where we could have been if people took it seriously.
Absolutely.
A year ago.
Right.
So, but let me ask you this, where do you think, before there's normalcy, I mean, where we're back to, remember the days when we were, remember COVID. I mean, I think it's at least a year. I really
I tell people that I don't see normal. I think we're going to see a totally new normal. I don't think it's going to be what it was. And I think I think a year is conservative. I think we're going to see a surge. They're expecting at the end in the fall to have another big wave when the weather changes again. There's talk that this might end up like a flu vaccine you get every year, and to your point, we really blew it when we had a chance in April, I think it was, or April last year, Fauci saying we need to shut the whole country down for like a full month, starve the vaccine. And this is a country where, we have states' rights. It's like almost impossible to get the whole country to agree on something like that. And once we lost control politically, health-wise, the messaging was off. I think we've lost our edge. So either we're going to come up with another better vaccine, and they'll know about immunity. They'll know about the need for boosters. And the good point, honestly, I think the good thing to remember is what an incredible age we live in, that we have the science, the
Be
technology,
able to do it. Yeah.
you know. So I'm pretty optimistic, but I don't think we're going to see a big turnaround in I'm saying in my head maybe 2023.
Wow.
Okay, I'm going to shut up now.
Wayne, you have a question?
I say I wanted to actually close on a positive note. I just read, I just read this morning in Good Morning Wilton that the statistics show that for the first 2 weeks in March, that people over 65, there are 0 new cases of COVID within the town of Wilton. And for that, that makes me very thankful and proud. And I wanted to thank a number of people. Our own Janet Johnson has been a tireless worker, but they put this together, got people vaccinated. And that's an exciting statistic. No new cases in 14 days for
Yes,
over
fabulous.
65.
It's fabulous. Absolutely.
So my question is, and we talked a little bit about this on the phone, come June, we've been postponing our gala celebration for our 10th anniversary. We are planning to have it at a place where, the governor has deemed you can have 100 people.
Mhm.
They have an outdoor area, they have ventilation. Most of our people will be vaccinated. And hopefully now with the governor coming saying that people even 16 over will be vaccinated by April. Is this, and given, what you were saying is things could get worse. There could be more variants, by next September, who knows? Is this something, do you recommend that we should go forward with, or do we need to be, to kind of get our people connected where they haven't been connected? Because we postpone, and if we postpone to September, it's probably going to be, we'll be in a worse situation.
So yeah, as Lisa and I were kind of I was telling her about my reunion and what a hard time we're having. I'm on the alumni committee, and I feel that the benefit from people gathering and the positive emotional energy that gives individuals, and the need to reconnect, if everybody's vaccinated, or if you can really be firm, and those who are not vaccinated, wear masks or really distance. I think the time to do it is this summer, is when you can be indoors, or at least open the doors to dining on a, where there's ventilation. There are a lot of precautions that you take with people serving food, which are easy to monitor. They can be tested, they can be mask wearing enforced. I will tell you that I'm really not that worried with people serving me food if they're masked. And I'm not worried about them touching my plates and my cups. We really know that the risk of getting this vaccine through touching things is small. And it's really respiratory. Yeah. But I will say, with people getting together in their families, I would really urge people to maintain disposable napkins and, throw them out after a dinner and not share them. And yeah, I think that a gathering that is limited in scope, and the governor has said 100 is, like what it's at, in a well-ventilated place with the majority of people being vaccinated, those who attend need to do this whole risk assessment. Are they healthy? What health issues do they have? Is it worth me going to see my friends, but I'm on a ventilator. I'm not ventilator. I'm on an inhaler. Somebody might say, no, I think I'm not ready for that yet.
Okay, fair enough.
But I do think that hugging people, I am not, urging us all to start hugging everybody that we haven't hugged. I still think that we keep a little bit of care. But I think when it's family and, you have a limited, you can assess their contacts with other people. I think that hugging and, having a little bit of that physical contact, I think it's and it is partly my opinion, but I'm basing it on what the CDC has said.
You can't bottle that feeling. In other words,
Right.
that's something that you can only get through physical contact. And especially, we talked about, I haven't seen either of my kids in over a year. And I'm like, grasping through
Zoom.
just to
Yeah.
touch them, it doesn't work. And just to be able to be able to have that someday is, I would take a little bit of a risk. I'm not sure if I'm going to get on a plane, but maybe I'll drive to Texas this summer. Who knows?
Yeah, that's
So
what my husband's doing. My husband's
bottom
driving
line-
to Texas.
Bottom line, in spite of the CDC and Dr. Fauci and the governor, that in our age group especially, we need to we want to take, how comfortable would we rather be outdoors? So it's just a personal decision.
Absolutely. Nobody can force anybody to do anything, but I think, if people are willing to do that and want that risk, it's something that
Absolutely.
you have to consider to be able to provide. So
I would really focus on anybody planning to do any air travel. Where are you going? What state are you going? How long are you going to be there? And what activities are you going to do there? But yeah, I think it's absolutely an individual decision.
I just saw a terrifying statistic last week. It said that 1.2 million children have lost, you saw that, at least one grandparent. And I think especially in our group, it's something, as Mary's daughter was saying a little while ago,
6-7 months ago, I think that it was hard to find somebody who was really touched by a COVID death.
Mhm.
And now when I talk to family, friends, almost everybody I talk to, and myself included now, I have more than one contact with somebody who's lost either a grandparent or an aunt or a husband. And it's mind-boggling. So whoever said they were going to leave it on a high note, thank you for that. I think we just came back to a lower note.
well, no, I think, and what you're doing in Wilton is awesome. Having that close by and not having to deal, having gone through the kind of tech stuff and waiting. I said to my daughter, it's like trying to get One Direction tickets, and I'm not sure if anyone can relate, but it's just going online and pressing the button and trying to see that you've gotten the seats. It was like that for getting an appointment. So having the concierge service or whatever through the town is.
Yeah, they did. The concierge service was really amazing. That the health department and Lynn Vanderslice's office did. And we're really urging the town, visiting nurse and hospice, and I'm the one that coordinates the clinics. I'm really trying to urge the town to let us do bigger clinics so that we can get more people in, regardless of where they live. Like it was Wilton, and now we need to open it up and offer it to anybody, or we're never going to get to our 80% vaccine rate.
But will you get enough vaccines to do that?
We have enough vaccine. It's amazing. We've been getting good amounts of vaccine. And I think you're going to start seeing that this week, where we're going to start opening the clinics. And my hope is that they'll allow us to do maybe a Saturday clinic where we can do it all day. I'd love to see us we've been averaging about 250 doses at a clinic, and I'd like to see us doing about 400.
Wow.
Or we're a small town, and visiting and hospice is a small entity. But
you wouldn't have many people to volunteer, and
we have plenty of people volunteering. I am blown away. I must have 20 nurse volunteers. I have doctors coming in to volunteer. Anytime we try to pull a clinic together, I actually call people and say, you know what, I'm sorry, but I don't need you tomorrow. What? I'm coming. okay, I'll find something for you to do. So, I mean, the energy and the desire to be a part of making this work, is really, it's really heartwarming.
Just have to say the town has been fabulous. Honest to goodness, we always love living here, but I just think from social services, everything that we've done with them to get our group vaccinated has just been just tremendous. It makes me really proud and grateful to live here. I think I'm sure we all feel the same way.
Better than Texas.
You think?
My daughter
Yeah.
did a thing last night. I guess on Monday nights they open up like a lottery if you're not eligible. And I kept calling. She's like, "I'm waiting. And I felt like I'm going to bed. So she didn't get through. So she has to wait till like next Monday. But I'm just like, oh my gosh, crazy.
Is she a Connecticut resident still or not?
Yeah, but I mean, I don't want her to get on a plane to come here.
Oh, that's a fine point.
Yeah, and she can't leave right now. She's so busy. But we'll see.
We're trying to plan a birthday party in August, and most of the family, and we haven't seen family. I haven't seen my son in 18 months, and I won't go to Texas. So I have already recruited people with tents, and I'm setting up tents in the backyard because the young people who are not vaccinated who are going to come, and when I say young people, I'm talking about people in their late 20s, 30s, they're going to be sleeping out in the tents. We're going to all eat outside. We're all going to eat outside. Those of us who are the parents and the aunts and uncles are all vaccinated. We can hang out inside and have a great little party inside. And the mid 20 to 37-year-olds will have their own party outside. And I'm hoping, I think it'll be, well, I'm going to try.
That sounds brilliant. What a great solution and fun.
Yeah, and the kids, I have one niece who has said, I don't do tents. I said, well, we'll give you an extra soft little mattress, princess.
Dan, do you want to speak?
Ann Byrne had a
Oh,
She's had her hand up a long time.
yes, unmute. I can't unmute her.
Oh,
Unmute.
And in the bottom left corner, there she goes.
Got it. Margarita, you talked about opening up. Now, I have a daughter that lives in New York City, and she's not old enough to come into the group that they're giving shots to right now, but she comes up here quite a bit to help me.
Mm-hmm.
Now, is there any way that she could get a shot in Connecticut?
It used to be in the very beginning that Cuomo and Lamont were letting people right close to the states close to each other get shots, but they're not anymore. No,
Okay.
but how old is she? Yeah.
53, something like that.
So
In New York, it
is
hasn't come up yet in New York.
because
She does go to Bellevue Hospital and get a test to be sure she's not positive every day, every time she comes up here.
So what my son and my son-in-law are doing in Texas is if you volunteer at a clinic, you get a vaccine. So
Yeah.
they're signing up to volunteer at a clinic, and I told them you have to actually volunteer. You can't just go get your shot and disappear. And they're
Right.
going to work like a day and get a shot. But she should be coming up in the next 2 weeks.
Yeah, I know that seems like a long time.
Yeah. I'm sorry. There is.
Work in a clinic out in Arizona, and he's gotten his shots. But
Yeah.
it's my daughter who comes up here.
Right.
She doesn't want to bring anything.
Of course
And
not.
I certainly wouldn't want to see her get anything. But Margarita, I do want to thank you also personally for helping me in the very beginning, and then even the day of the shots, you helped me. So thank you.
Oh, you're welcome. So glad to hear that.
Very good. Any other questions out there?
Any questions?
Well, I am easy to find at Visiting Nurse and Hospice. If you come up with any questions and you want to leave me a voicemail, or you can email me at mshapiro@visitingnurse.net. Happy to respond with emails. I am terrible with emails, and my voicemail says it on my cell phone. Okay, you might have to wait a while for an email. I'm much better with texting, but I am better with my work email. So if you come up with any questions or I can help in any way, please reach out
Thank
to
you
me.
so much. That
Yeah.
was excellent.
Yeah.
Thanks.
Thank you.
Thank you very much.
My pleasure. My pleasure. Nice to see you all. Bye.
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 Thank you so much.
Thank you.